Raquel Leyva reached out to Fox 61 worried about her husband because she says what goes on behind these bars is inhumane. The State Department of Corrections say that they are following CDC guidelines, but Leyva says what she's heard is a different story.
Horrible, unsanitary conditions that he in his 24 years had never seen anything like it.
Raquel Leyva speaking one-on-one with Fox 61, saying her husband, 48-year-old Peter Gonda, has seen some scary conditions at McDougall Walker's medical isolation unit.
Didn't even want to bring his clothing back with him when he got out of there. He had to use his own clothing to clean the cell and the surfaces around him because he wasn't given cleaning supplies.
Her husband is serving a 40-year sentence for his involvement in a murder plot. She says the 67-year-old inmate first got sick with the coronavirus in November and was transferred to an outside hospital. And weeks later, when the news spread about the inmate dying, Gonda told Leyva the virus had already spread like wildfire in the unit.
When he told me that someone died, he said that, somebody came into the facility for a program who was checked but had no temperature and therefore was completely asymptomatic, yet were carrying COVID, and got 40 inmates sick in the same wing.
From the reports handed down from the Department of Corrections, the numbers add up. The week the deceased inmate was transferred to an outside hospital for treatment, the DOC said 46 inmates tested positive, but the department says they are still following health and safety guidelines. In a statement, the department says the McDougall Walker Medical Isolation Unit was chosen based on its structure and quick access to an on-site medical triage. The department even adds that they are doing a, quote, incredible job under trying circumstances and constantly reviewing policies and procedures to better protect their staff and inmates. Leyva says she knows people are cautious of letting inmates out due to COVID, but says she wants people to imagine being her.
Unless you have someone inside who you can talk to regularly, nobody knows these things, and it's very scary and it's very discouraging.
Leyva and an activist group like the Cattell Center say more people need to be let out. Although according to the DOC, they have already released 3,100 inmates during the pandemic.
There needs to be independent review of what is happening behind those walls that they hide behind safety and security.
Leyva and the Cattell Center say that they will continue to advocate for those locked behind bars, but the collective also says that a more comprehensive plan is needed to release inmates now more than ever due to a second wave of COVID-19 in the state of Connecticut. In Suffield, Brian Ditlake, Fox 61 News.